Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul. Today we are going to discuss with you the case of the patient who underwent a hair transplantation surgery in May of 2023, almost 18 months ago. This is a 25-year-old white male. He had the neurotype 4V to 5 of the hair loss. What does it mean? Neurotype, first of all, when we evaluate the patients for the hair transplant surgery, one of the things we do for sure is that we stage or grade their hair loss pattern. For this purpose, we use the Norwood-Hamilton scale. On Norwood-Hamilton scale, the male pattern baldness is graded from stage 1 to stage 7. 1 meaning the least and 7 meaning the most of the hair loss. Most of the time, the hair transplantation surgery can be carried out starting from stage number 2. So the higher the degree of the stage of the hair loss you have, the higher is the demand or need for the grafts to meet the expectations of the patient. So as we mentioned before, the patient had a neurotype 4V to 5 of the hair loss, meaning first of all the loss of the continuity of the front hairline, empty spots on the both right left temples, weakened front forelock, front third. There was some thinning and miniaturization in the mid-scalp, and during the evaluation, the live check of the patient, we also noticed some miniaturization in the crown area. So basically, all three areas, the front, the mid, and the crown, were affected. The most affected part for the patient was the front side, and the priority and expectation from the patient was to restore the front hairline, cover the temples, and reinforce this front side. So the front side was the priority, and depending on the number of the grafts, we decided that we are going to reinforce slightly the mid-scalp transition zone and as much as possible the crown area. So the patient was extracted 3,900 grafts. Out of this number, 1,500 of them were the singlets. We had around 2,000 of the doublets, and we had around 400 of the multiple grafts, meaning 3 and 4 follicles and more. So out of this number, 2,800 was implanted in the front, was used to rebuild the front hairline, cover the front temple sides, front forelock, front third. So mainly the front frame of the face. 550 of them were used to make the transition from the front side to the mid scalp, and 550 of them were used to densify or increase the density of the crown area. So all in all, 3,900 grafts were used. And you can see here that even on the pictures of before the surgery, that the most affected area is the front and the temple sides. And as a result of the surgery now, almost 18 months after the surgery, you can see how dramatically the outlook of the patient has changed. The hair transplant surgeries can be really dramatic and life-changing surgeries when done appropriately. One of the aspects I want to emphasize once again, especially for this patient, you can see how conservative the hairline is. We always tell the patients that one of the golden rules in the hair restoration surgery is to keep the hairline conservative and simple, because it gives us the chance to make the area to be transplanted smaller. So it gives us the chance actually to give the patient more coverage and the density, because the hairline has a dynamics. It has its own dynamics, and when we restore the hairline, there are some criteria or pitfalls you have to avoid or pay attention to, so the hairline becomes natural. Most of the time we ask our patients, you want the perfect hairline or you want the natural hairline? And as a surgeon who is performing the surgery for almost 10 years now, I definitely advise my patients to go with the natural hairlines. The criteria for the hair restoration is the anatomy of the face. It's the height of the forehead muzzle. When you raise your eyebrows, you can see this wrinkles. This is actually the muzzle, so we need to stay above the muzzle. Other aspect is the age of the patient, because we know that for the younger patients, over the years, the hairline naturally recedes more to the back. This is called the maturation of the hairline. So when we're 20, it's different, 30 is different, 40, 50 is different. So we want the hairline to be age relevant, and we don't want you to be when you're in your 40s, 50s to be with the hairline of the boy who in his 20s. That's also very important. Other aspect is does the patient have the inactive hair loss process? Because when you rebuild the hairline aggressive or low, and if all the time the patient loses slightly more of the hair, you may end up like with an island of the hair here, empty spots to the corner or upper sides, and hair again. So these are all the variables and many more that we have to keep at back of our mind. So it's not only, of course, the expectation of the patient are the key factor here, but on the other hand, there are some rules we have to make sure we follow them up, so the hairline becomes natural and stays actual for the patient for the rest of his life. Now we can see the results of the patient 18 months after the surgery, but these pictures were taken and 1 year after the surgery. So now most probably the patient's results are even in better condition. So you can see that the front hairline is fully restored. It looks really natural. It doesn't look like the patient had the hair transplantation surgery. The front area has a good density. The mid scalp and the crown area has a good density as well. So we have got the purpose of our surgery to restore the front hairline and try to cover the front side and add more density to the mid scalp and the crown area. The patient is happy. We are happy. One more natural and good looking result for the hair transplant surgery. Thanks for watching, guys. Stay tuned, and if you have any questions, you can always leave them as a comments underneath this video. Good luck and see you.